Welcome to OAC Health Talks. I'm Joe Naglowski, President and CEO of the Obesity Action Coalition, and we are excited for you to join us for this educational series that dives deeper into specific health topics that we know are important to you and the OAC community. Health Talks are designed to empower you while providing straightforward, practical answers and insight from trusted experts. So let's dive into today's topic.
Hi, I'm Corrigan McBride, and I'm the Director of Minimally Invasive Bariatric and General Surgery at the University of Nebraska Medical Center in Omaha, Nebraska. I'm also an Executive Council member of the American Society of Metabolic and Bariatric Surgery, and I am thrilled today to talk to you through the OAC platform about sex and bariatric surgery. Anytime you give a professional talk, they ask about disclosures, and I am not being paid to give this talk. But I do think it's important to share with people that I have had bariatric surgery. I had a lap band, and I had my lap band converted to a sleeve. So when patients ask me questions or are going through something, odds are I had those same questions before I decided to have bariatric surgery, or in some of the struggles I have shared as well. Most of the time when you meet with a bariatric team to discuss metabolic and bariatric surgery, they're going to show you some version of a picture like this, or a chart, or a graph that talks about what are the chances that your diabetes will go away, or your high blood pressure, or your high cholesterol. And recently, there has been a lot of data being talked about in the media about decreasing your risk of heart attack, stroke, cancer, and even dying from cancer. But sometimes as a patient, I feel like these two areas don't get talked about enough, and that's quality of life. And for women, polycystic ovarian syndrome is going to be something we're going to talk a lot about, but particularly the quality of life. When I talk to patients 6 months, a year, 2 years after their bariatric surgery and ask them, are you glad you did it? And if so, why are you glad you did it? None of them ever answer because my diabetes went away or because I lowered my risk of a heart attack. What they answer is my day-to-day quality of life is better. I can tie my shoes without getting short of breath. I can fly without the seatbelt extension. And for a certain percentage of people who one of the things that they really want in their life is to improve their romantic and other relationships or maybe have children, these are very important things that we sometimes don't talk about enough. But they are essential to the quality of life and if people are happy that they had surgery. So what I want to try to touch on today in the time we have together are what does the data show about romantic relationships, sexual function and activity after bariatric surgery. We will also talk about infertility, both from the men and the women's side of the equation, and then a little bit at the end on pregnancy. But I'll be honest, pregnancy could probably be an entire talk on its own. So when we think about what makes up a healthy relationship, whether you're talking about a platonic relationship, a friendship, a sexual relationship, or a romantic relationship, these are the kinds of words that people tend to use when they talk about having a good, healthy relationship. You'll notice weight is not on there anywhere, BMI is not on there anywhere, and that's because weight does not necessarily have anything to do with a healthy relationship. We all know heavier people that are in very good relationships, and we also know thin people who are in dysfunctional relationships. But the role bariatric surgery and weight plays on our relationship can be very important. In the last couple of years, there's been a lot of press, like I show on the screen here. Weight loss surgery changes relationships. Couples are more likely to break up. And these are really sensational headlines. But what does the data actually show? Now, some of this comes from some studies that were done in Sweden, like the top right of the screen says. And those studies are important to know about, and your surgeon and your surgeon group should be able to talk to you about them. But the fact is relationships in Sweden are different than the United States. The rate of marriage is different, and the rate of divorce is different. So we can't compare ourselves to a Swedish population. So I went out and I tried to find the only study about an American population. This study was done many years ago, but then they followed the patients for 5 years. So 6 centers submitted all of their data and they looked at it. And they've looked at all kinds of aspects of what happened to these patients over that 5 years. But there's one particular paper where they specifically focused on marriage, separation, divorce, as well as patients that started single, what were their chances of getting married? So the good news was 81% of the people who were married when they had their surgery were still married after 5 years. Now, that does still mean 19% were not still married, but 8% of those were from divorce, 5% were separated, so we do not know what the outcome was over the next couple of years, and 6% were widowed. Now, 8% divorce is higher than the national average of 4%, but it's certainly not as sensational as some of those headlines made it sound. On the other side, 70% of the people who were single when they had their surgery were still single 5 years later. Now, for this study, they didn't specify what single meant. It simply meant not married. So they absolutely could be single living alone, single in a relationship, single living with someone and cohabitating. We just don't know. But of the unmarried people who started the study, they were 18% of them got married at 5 years. And that is much better than the US national average of 7% over the same time period. And the other thing that I thought was really great about this study is they looked at like how much weight did people lose and did that predict things? And it didn't matter. You could have a good result, a great result, or a rock star result from bariatric surgery, and your chances of getting married increased. What it really correlated to is improvements in physical health. How much energy do you have? How well do you sleep? Things like that. So, but why does this happen? Well, anyone who's been in a relationship, whether you're talking about your best friend or you're talking about your husband or wife, relationships are a balance, and we all are learning and we're all growing and we're all developing. And when things upset the balance, then disruption of the relationship is more likely to happen. And we know this from all kinds of things. You know, if someone loses a job, it can be stressful in a marriage. If a child enters or leaves the house, it can be stressful in a marriage. But for bariatric surgery, what basically happens, we think, and from talking to lots of patients over my 20-year career, patients who have bariatric surgery start having more energy, they have more confidence, their appearance change, how they feel in clothes changes, how they feel naked changes. They are often receiving more attention from other people around them that can be very disconcerting to the partner who did not have bariatric surgery. Sometimes after bariatric surgery, because of these changes, people become more social. They want to go out, they want to go dancing, they want to go to clubs, and that's not what the other partner wants out of their life and their relationship. But the one that I think worries people is increased sexual desire. There is no doubt, and I'm going to show you in a little bit, both men and women seem to have more sexual desire and less sexual dysfunction after bariatric surgery than at their baseline. Well, if one partner is suddenly wanting to be more sexually active and the other partner is not, that can be very destabilizing. And in fact, all of these things can threaten the balance in a relationship. So what do we do about it? Mostly, just like any relationship counselor has probably ever told any of us, the key is communication. We will all have a support system around us when we have any major changes, including bariatric surgery. And your support system can include your best friend, your spouse, your siblings, your parents, your church group, your coworkers. Everyone's support system is going to look different. But we have to figure out how we're going to interact with our support system, particularly our spouse or our life partner or the person we live with. So one of the recommendations that psychologists who work in this field really recommend is make sure you're asking for the support that you need. Don't assume that people in your life know what you need. And you can ask them multiple times and you can ask them multiple ways, but you sometimes have to be prepared for them to say no. You need to be specific, not broad requests, and not requests that most people would think is unreasonable. So if you're talking about your support system at work, it's probably not reasonable to say nobody should ever bring sweets to work again. But it is reasonable to say, could we put all the brownies in the break room and nobody bring me a brownie? Well, the same kind of thing happens with our spouse. We need to talk about with our spouse before we ever have surgery about how things might change, but also after surgery, if things are changing in a way that you weren't expecting it, you need to talk about it. So if you do notice or have an increase in your sex drive, the answer is to talk about it with your spouse and to see what can be done to help them as well, to see if you can get on board so that your sex drives are in balance. But it's more than just sex. A lot of our relationships with our romantic partner is about life in general. So are things going to change related to doing dishes, taking kids to after school activities? If you need help, you need to learn how to ask for help. But also, not everyone in your life is going to be able to do everything in your life. You know, your spouse may not be your exercise partner, or your exercise partner may not want to do what you want to do. But if you ask them to go for a bike ride and they don't want to go for a bike ride, you could still ask them for an alternate physical activity or exercise, like going for a walk. The other thing about the support system, when it's particularly seems to be stressed, is in those first few weeks right after surgery. Who is going to help you with surgery? Do you have household responsibilities? If you are a stay-at-home mother or father and you do all the cooking, all the dishes, all the shopping, all the pickups and drop-off and kids, and suddenly you're told by your surgeon you can't drive for 2 weeks, how is that workload going to be redistributed? When you talk about your family, we talk about spouse a lot, but this can also have an impact to anyone else who's living in your home because meals will likely change. For those first 6 to 8 weeks, what you are eating is not necessarily what your family wants to eat. And so are you going to cook 2 different meals? Is someone else going to take over making the meals for the entire family so that you can focus on what you need to eat on? Are there foods that are absolutely triggering? You either can't stand the smell or the smell is so savory and delicious that you're going to want to eat things you shouldn't eat. I had this happen a couple years ago with a patient of mine. Her husband would get off work every day and he would stop at McDonald's and he would come home and he would eat that as almost a snack and then they would have dinner later. And the smell of the McDonald's French fries made it very difficult for my patient to stick to what she should and do eating. But he also didn't want to give up his McDonald's. Well, it became as simple as saying, can't you do McDonald's for lunch and do something else for your snack when you first get home? And yes, that is a reasonable ask, and the partner was able to do that. You also need to think about how you're going to handle holidays and parties. There are going to be some things that you may not want to go to, or you may still want to go to. So social situations can be really challenging. You know, there are going to be some people in your life that you realize the only time we ever get together is to go out and either eat or drink. And maybe those are things you shouldn't be doing right now, or those are not the restaurants or bars you should be going to. So do you need to take a break from those places in order to be successful? You need to think about parties and gatherings. When I had my bariatric surgery, I was on my preoperative diet over Mother's Day, and my mother-in-law very generously invited everyone over for a big meal. But I just knew I wouldn't be able to stick to my preoperative diet if I went to the party. So for 1 year, I opted out of Mother's Day, but I still get invited to every other party and every other Mother's Day. Think about what your family and friends can do to help you be successful. And are family and friends different than your spouse? Sometimes we need different things from our spouse than we need from our best friend. Do you want your family and friends to say something if they see you starting to nibble on things you shouldn't or eat something you shouldn't? Some people want their family and friends to ask the question, are you supposed to be eating that? But other people don't. They find it nagging and annoying, and they do not want to hear that from family and friends, especially their spouse. And then think about ways that your family can say, I love you, without it being food. If your spouse always brings you candy to make you feel better, and candy should not be brought as the present anymore, what else can they do to help show love? Now, Relationships are more than sexual activity, but it is certainly one of the biggest areas that concerns people when we're talking about our romantic relationships. And we actually do know. So this was a really great study that specifically looked at men and asked them about the quality of their sex life before bariatric surgery and after. So this is just the before numbers. Before numbers, 36% of the male patients had erectile dysfunction. 54% had difficulty achieving an orgasm. 34%, only 34% of them rated their sexual desire as good or great, which really meant only about 25% of them were really satisfied with their sexual part of their lives. 1 year after surgery, the numbers all changed and in the good direction. So the percent of men reporting erectile dysfunction went down. The number of patients that reported that they couldn't orgasm went down. Those that rated their sexual desire good or great went up, almost doubled, and the sexual satisfaction in their lives also almost doubled. Now, similar studies have been done with women, and in fact, there's a lot more studies in women than there are in men. This is what we call a meta-analysis, meaning they took all 20 of the studies that have been done and compared the data. So we really know, is this true? Because we're talking about thousands and thousands of patients. And in fact, in women, after bariatric surgery, sexual desire improves, sexual satisfaction improves, the ability to arouse improves, lubrication improves, and the ability to achieve orgasm improves. But also, the incidence of having pain during sex goes down. All things that we want for a good and healthy sex life. And again, much like the divorce studies, these were not related to the amount of weight loss. So whether patients had a good, great, or an amazing result after bariatric surgery, the sexual improvements seem to be across the board. Now, one of those topics that I was asked to specifically talk about is infertility, because this is a significant detractor for many people. And many people who are heavy have been told by their doctors that it is the result of their weight. And the first question everyone has is that true? But then the second is what can we do about it? So in women, it is true. So just so we're all talking about the same thing, infertility, the medical definition of infertility is inability to get clinically pregnant, meaning having a positive pregnancy test after 12 months or more of regular unprotected sexual activity. Now, in women, probably the most common reason is polycystic ovarian syndrome, or PCOS. But there are several other reasons, including ovulation dysfunction, meaning just not ovulating an egg, tube and peritoneal factors, particularly as they relate to endometriosis. So the reason this is so important to talk about is PCOS is the most common endocrine problem for women between the ages of about 18 to 50, which is what we call reproductive age in the United States. And the reason this is so important to so many women is it tends to cause two major things. One, they do not ovulate, meaning they are not passing an egg every month. And two, they have too much testosterone in their body. Now, the too much testosterone can cause a lot of different things, but physically what people see is the facial hair, more hair where women don't want hair is the easiest way to explain it. In addition, it can cause menstrual irregularities. So it doesn't matter if you pass an egg, if your uterus isn't getting ready every month to think about having a baby, then you're not going to have a successful pregnancy. The too much testosterone can also cause problems like heart problems, obesity, diabetes, and insulin resistance. So, as a result of this, it is true that obese women are more likely to have menstrual irregularities. They do not tend to have as many eggs pass in a 12-month period of time, and the eggs that they do pass are not as good a quality and so are not as likely to end up resulting in a pregnancy. So the result is it takes longer for them to conceive, whether they're doing it naturally or using any of the artificial reproductive technologies. And if they do use what we call ART, it takes more medicines to achieve a successful pregnancy. Now, women are only one part of the infertility equation. Men also struggle with infertility. And the question I often get asked by patients is, well, could it be my husband? Well, if your husband is heavy, yes, he is part of the equation. Obesity in men has a negative impact in semen quality. It is just not the environment that the sperm need to live in to be healthy. The sperm integrity, meaning each little swimmer doesn't live as long as we want those little swimmers to last. And the result of those two things in men result in fewer conceptions with their partners and fewer live births, whether they conceived naturally or they used assisted reproductive technology. So what can we do about it? Now, again, whole different talk about medical weight loss. And there is good data that simply losing 5 to 10% of your body weight through medical means can improve things as far as fertility. But this is specifically a talk about bariatric surgery. So how can bariatric surgery help? So this study was done in the Middle East, and they surveyed both male and female patients who were struggling with fertility, and they looked at both sides of the equation and what was the impact. So on the women's side of the equation, women's female sexual function, meaning do they want sex? Do they enjoy sex? Are they comfortable during sex? Do they achieve orgasm? All improved in women. All of the hormones that have to do with having a normal cycle also improved. And if you don't have the hormones cycling normally and regularly, you're not going to ovulate, you're not going to have a uterus that's ready to accept a baby, and you're not going to have successful pregnancies. And in fact, by 6 months, most of the patients who'd started with abnormal periods now had almost normal periods. Now, as far as women with or without PCOS, it does actually make a difference. So women who have PCOS and get bariatric surgery notice a more pronounced impact than those who did not have PCOS. They have significant weight loss, they have lower testosterone levels, they have improvements in their blood sugar, and they have even better normalization of their menstrual cycles than patients who did not have PCOS. This is sorry, I don't know why it's all squishy on the screen, but hopefully the important part of this study is they had 216 patients that were going to have bariatric surgery that were premenopausal, meaning they absolutely could have a baby from a menopause standpoint. 21 of the women specifically said that the reason they were having bariatric surgery was they wanted a child and had PCOS. And then there were another 38 patients, not percent, 38 patients did not have PCOS but wanted a child. So that's what things looked like when they went into surgery. So what this slide shows, and it's a little small, but hopefully you can see, basically of the PCOS patients, 40% of them were able to get pregnant. And of the non-PCOS but still having infertility issues, about 25% of them were able to get pregnant. Now, if you specifically looked at those 21 PCOS patients who wanted to have a baby, over 95% of them were successful in getting pregnant, and about 80% of them were able to have a baby after 9 months. On the other hand, the patients that did not have PCOS did not have as great a pregnancy rate, but it was still 77%, with 70% of those women successfully having a successful pregnancy and a baby. So the conclusion of that is yes, bariatric surgery helps improve PCOS, and particularly women with PCOS are more likely to get pregnant after they have surgery. Now, what about the male side of the equation? This is that same study that was done in the Middle East, and essentially they saw much like we saw before. Surgery improves erectile dysfunction scores at 12 months in men. It improves all of the male sex hormones that have to do with sperm and semen production. And so at 1 year, the semen and sperm did not seem to change, but this study had a very small number of men who were able to give them sperm specimens and semen specimens. So I'm not sure we can actually apply that to everybody. Now, what happens if people do get pregnant? As I kind of mentioned at the beginning, honestly, this could be a talk unto itself. But what I really wanted to reassure everyone is there is excellent literature about getting pregnant after bariatric surgery. When you compare people who had a pregnancy after bariatric surgery to very similar patients based on their preoperative BMI. Having bariatric surgery lowers the risk that you will get gestational diabetes, lowers the risk that you will have a large for gestational age baby. There's a slightly higher chance of having a small baby, but there is no difference in the risk of preterm labor or needing to go to the ICU or anything like that. The key is that these pregnancies need to be planned. You need to be on good birth control for the first year after surgery, then go off the birth control, make sure you're taking all your vitamins, and then try to have a baby. And then the final thing I wanted to share was just a little comment on breastfeeding. Breastfeeding is very important to many women who do get pregnant and have children, but it can be a challenge after bariatric surgery. Breastfeeding requires a significant increase in water intake that, depending on how far people are out from surgery, they may not be able to drink enough water and eat the slightly more calories they need to make enough milk. And in one very small study, what they found is 86% of the patients did have to supplement for their babies because they had a low supply. That doesn't mean they shouldn't try. They absolutely can be encouraged and supported, but they need to go into it understanding that they may have to supplement the supply. So in conclusion, yes, some of the questions I was asking at the beginning. Yes, bariatric surgery does have a higher rate of divorce than the average population, but it's not 50% or 75% like the sensational headlines say. It's 8%. But there's a higher risk of marriage than the average population. Maybe we shouldn't call it a risk because hopefully that's what those people wanted, but you have a better chance of getting married after bariatric surgery than if you did not have surgery. It improves sexual function for both men and women, as well as we know obesity can contribute to infertility on both sides of the equation, and bariatric surgery can help improve both sides of the equation. And patients absolutely can have successful pregnancies after bariatric surgery, and they can breastfeed, but they may need to supplement. Thank you very much. I just want to end by saying thank you to some of my colleagues. This whole talk came out of a 6-hour seminar that was hosted at the FASMBS Obesity Weekend, and several of my co-presenters at that session were kind enough to share their slides that I was able to incorporate into this talk. I hope this helps and helps open the conversation with your bariatric program on whether these things that bother you or are affecting you might be improved by bariatric surgery. Have a nice day.
The OAC has a variety of educational opportunities for you throughout the year, but one of the best places you can turn to for quality, unbiased education is our resource library. Simply visit obesityaction.org/library to check out our brochures, articles, guides, videos, and more health talks. Also be sure to subscribe to our YouTube channel to get notified about any future educational events. Thanks for joining us.